name is Emily Spoth, and I'm a genetic counselor at the University of Utah. A lot of my work as a genetic counselor is explaining genetic contributions to different health conditions, so today I'm going to talk about genetic factors of ALS. Before we talk about ALS, we should talk about genetics as a whole. A gene is just an instruction manual for the body. It tells the body how to grow and develop and function. We have around 20,000 genes in our bodies, and they're all held on bigger structures called chromosomes. Around 99.9% of all of our genes among us are the same. That remaining 0.1% is different, which we call genetic variation. Any genetic variation is what makes us different from each other. It's what gives us traits, like eye color and height, but can also contribute to different health conditions. With ALS, around 90 to 95% of the time, we do not see it running in families in a really clear way, so we call it sporadic inheritance, meaning that usually we only see one person diagnosed. For these individuals, we expect that multiple factors have to work together to cause ALS, and it's not just one thing that causes ALS for anyone. There are a couple risk factors that we know about for sporadic ALS. Age is the biggest one. So most of the time, ALS is diagnosed in individuals who are over the age of 50. The most common age of diagnosis we see is 55, but it can really be a range all the way up to age 75. And certainly we see some folks diagnosed younger. The other thing we know is sometimes different for our folks is that men are more frequently diagnosed than women. Around 60% of our folks diagnosed with ALS are men. The other thing we've found through research is that our veterans may be twice as likely to develop ALS as folks who never served in the military. We don't know for sure why this is, but we sometimes expect that there could be a common factor among our veterans that just doesn't exist in our civilian population. But research has not really shown any specific factor like an exposure that would be the cause of that. The final thing that we know contributes to sporadic ALS are genetic factors. They're not entirely the cause for folks. It's not just one genetic factor that causes ALS. But we expect that they're lower level risk factors that could be contributing. These risk factors are usually common changes in the general population that we share. There's still genetic variation because they're different among folks, but they're common enough that we see them over and over again. That might just tweak someone's chances of developing ALS. Because of these genetic contributions, as well as other factors that we share among our family members, like the environment we grow up in and the lifestyle that we kind of emulate, we expect that close family members, that's the siblings and children of someone diagnosed with sporadic ALS, have a slightly increased chance over the general population to develop ALS. It's around a 2 to 4% chance, where the general population chance is around 0.3%. So again, this is a 96 to 98% chance that they won't develop ALS, but it is slightly increased. Our folks who do have a really strong family history of ALS and multiple family members, we say have a familial form of ALS. Usually this is multiple folks and multiple generations that get diagnosed. So pretty typically maybe a grandparent, then 2 or 3 folks in one generation of siblings, and then their children as well. And in these families, we expect that there is one underlying non-working gene that's passed down in the family that causes ALS for those folks. Opposed to the genetic variation that could be a risk factor in sporadic ALS, these are rare changes in genes that we know for sure make a gene not work and cause a health condition that we call mutations. You can think of these like typos in our genes, which are really just big long strings of letters. So any spelling change, extra piece, missing piece that we know for sure makes that gene not work. Through research, we've identified a number of genes that, if they're not working, can cause a familial form of ALS. The most common of these that you might have heard of is a gene called C9orf72, and another common one is a gene called SOD1. So if we were to perform a genetic test in an individual with a familial form of ALS, we might find a mutation in one of these genes. Which brings me to genetic testing. Right now, we routinely only do genetic testing in folks who look like they have a familial form of ALS, where it's running in multiple folks and multiple generations, because those are the individuals that are most likely to have a positive test result or a mutation actually found on their testing that would explain their ALS. When individuals with sporadic ALS undergo genetic testing, it's unlikely that we would find an underlying genetic cause through that testing. So it just wouldn't be helpful for learning more. Genetic testing is always a personal choice for any individual, regardless of what their health concern is. So if you're interested in thinking about genetic testing, I always recommend that you talk to a professional who knows a lot about it, whether it's a genetic counselor like me or a doctor. If you don't know of anyone close to you that knows a lot about genetic testing and can help guide you, I recommend looking at the National Society of Genetic Counselors, which is a professional organization for genetic counselors. They have a website where you can find a local genetic counselor close to you. Something that might change in the future about genetic testing, this is true right now, but we are expecting that as we learn more about genetic factors in sporadic ALS, the genetic testing might get expanded in the future. So if you are ever interested or want to learn more about genetic aspects of ALS, you can always talk to your doctor about it.